Lateral glide, rotation, seated, hands down on a human.
Once again, for the atlas, we're going to look at two motions. We're going to look at both lateral glide or translation, which occurs along the positive and translation along the positive and negative x-axis. We're also going to take a look at rotation, which occurs along the positive and negative theta y-axis. For translation, we're going to look at left lateral glide or left translation, the ability of the atlas to glide to the left. In this case, your segmental contact point is going to be the lateral aspect of the TVP on the right-hand side. To establish that contact, I first palpate for the inferior pole of the mastoid. From here, I palpate immediately inferior and then medially. As we said beforehand, sometimes if you have difficulty feeling the TVP, you feel you can't get deep enough. You'll usually find this more on males with well-developed necks. What you need to do is it's because when you palpate it inferiorly of the mastoid, the tissue is too tight to allow you to get deep enough. So to compensate for that, what you can do is you can take your contact point, slide a little bit more inferior, immediately inferior, and then take tissue pull from I to S so you virtually come up underneath the mastoid. So it's going to give you a little bit more ability to get in a little bit deeper. Either which way for our contacts, the alternate analysis says what I'd recommend that you do too. Sometimes if you palpate the back of the posterior ramus of the jaw, you're probably too far forward and you're in the person's styloid process. And a guarantee that you're in there is that the patient coughs, you're too far forward. So to protect against this, sometimes what you can do is you can saddle the inferior pole of the mastoid basically in your fingertips here. It gives you a broader contact so you can kind of feel where it is a little bit easier, and it tends to prevent you from getting too far forward. So we have one or two methods we showed in class. Again, for the test, the way that you prefer is up to you. One, I can contact the lateral aspect of the TVP. I can stabilize the occiput, and from here virtually I can spring from lateral to medial. In this case it's going to be from right to left, feeling just the give and the recoil quality of it. Or two, and it seems to be preferred by a lot of students, is not only am I going to contact the TVP on the right hand side, I'm also with my indifferent hand, I'm going to palpate and contact the lateral aspect of the TVP on the left hand side. In essence, I'm trapping the atlas between my two fingers. From here to assess left lateral glide, I'm still going to push from lateral to medial from right to left and feel the give and the resiliency or lack of thereof. But simultaneously, what you'll feel is the atlas will feel it translate into the other contact side. And people seem to like this because they can actually feel relative movement. Again, it's important, whichever one I choose to use, I need to stabilize the occiput or the cranium so that the musculature can relax. In essence, on the test, what people like to do, because they like this maneuver, you'll see them palpate or push it both back and forward. That's okay. But on the exam, we're going to say we want you to assess left lateral glide. We're going to ask which one do you want us to assess, in which case we expect you to lean upon, I'm going to be pushing into the right-hand side from lateral to medial, in this case from right to left, and I'm going to feel for the translation into the left for the exam. If we choose to, I should say, if you choose on the examination to do the examination with your hands in an upward position, we're going to require that you said we're going to be using these motion palpation stools. So remember, your hands down, down, you're blue, you can use these chairs. With your hands up, touchdown! We're going to use the red chairs. Can't associate one or the other, but red up. Tara, if I could, I'm just going to have you face the wall over there. For translation and glide, your segmental contact point is going to be the lateral aspect of the TVP of the atlas. I'm going to assess left lateral glide, so therefore my segmental contact point is going to be the lateral aspect of the TVP on the right-hand side. How I establish this is I first feel the inferior pole of the mastoid. From there I slip immediately inferior and then palpate medially. My indifferent hand is going to stabilize the patient's head. From here, if you're graced with that, you can actually contact both. Again, we'll show two methods. The choice that you choose is completely up to you. That can make a sense, choice you choose, but it'll come. From here, once I palpate the lateral aspect of that TVP, I could, one, stabilize, in this case, Tara's head, and I'm virtually going to pull from right to left, lateral to medial, feeling both the give and the resilient quality in that joint. or lack thereof. Or two, if you like to use the pitch and catch method, you're going to literally contact both TVPs simultaneously. In this case, on the left-hand side, I'm using my thumb. In essence, I've trapped it between my two fingers. Now, as I pull from lateral to medial, I can actually feel it translate into my thumb simultaneously. Not only feeling the giving quality here, but I actually can feel it translate into my thumb, on this case, my other side. The caveat with this is a lot of people like to go back and forward. That's okay. But on the examination, you'll be asked to show us which one do you want us to assess. And if we're assessing for positive X translation or left lateral glide or left translation, it will be expected that you're pulling into the right side, feeling the translation into your thumb on the left.